Melissa Bernstein, and she's going to take it from here. So thank you so much.
Thanks so much, Jess. Hi, everyone. I'm Melissa Bernstein, and I'm very excited to be with you all today for the next 2 hours on this Tuesday morning. I really look forward to presenting on this topic. I think working with caregivers and families around behavior problems is challenging enough on its own, and then adding the element of trauma just makes it a bit more challenging. So I'm going to be sharing some evidence-based approaches with you all and techniques on managing challenging child behavior, keeping in mind that trauma-informed lens. These are strategies that I've used in my career with children and families that I really believe in, so I'm excited to share with you all today. I'm going to be using the word caregiver throughout the presentation. And when I say this, this really refers to a biological caregiver or a resource or foster caregiver or a kinship caregiver like grandparent, aunt, grandfather, etc. So this topic is pretty information heavy. So I really invite you guys to ask questions. You already seem like a very engaged group. I love that there's folks from all over California, from Florida, I think I saw Arizona, Ohio. So please feel free to kind of ask questions. I'll try and keep my eye on the chat and the question and answer box. And hopefully this can be an engaging back and forth between us. But if I don't get to your question, I'll try and make sure we spend some time at the end to answer that as well. Okay, so let's dive in. So what we're going to talk about today together, we're going to start with the impact of trauma on parenting. Then we're going to move on to functional assessment. So how do we figure out what's going on? Really highlight the importance of relationships when we're talking about dealing with challenging child behavior, and then move into strategies to shape behavior. I see that New York's in the house, which is very exciting. I'm actually from New York City, so that's nice to see. Okay, so let's start with the impact of trauma on parenting. I'd like to just do a little level setting. So when I say trauma, what are some of the traumas that you all see in the children and families that you work with? So what are the different types of trauma that you come across in the work that you all do? And you can just add that into the chat. Okay, so maybe children having children, neglect, sexual abuse, verbal and physical abuse, domestic violence. Well, it's coming in so quick. I'm trying to follow. Homelessness, emotional abuse, separation, divorce, and substance abuse, custody battles, absolutely severe neglect. You see a bunch of that. Sexual abuse, domestic violence, homelessness, teen pregnancy, separation from parents, COVID, right? This global trauma that we're all going through. Great. So it seems like we're all on the same page when we're talking about trauma. So throughout this presentation, when I'm talking about trauma, I'll really be addressing all of these: food insecurity, PTSD from domestic violence, all of the things that you guys mentioned. Okay, so we're going to be diving into behavior problems in kiddos who have experienced trauma. But another chat moment, I promise I'll lean off in a little bit, but I want to hear from you all. What are the behaviors that parents come to you with that are really the most challenging? Sometimes we talk about that magic wand question where we ask if you had a magic wand, you can change one of the most challenging behaviors, what would it be? So aggression, isolation, feeling withdrawn, temper tantrums, defiance, anger issues, maybe distrustfulness, tantrums, a lot of tantrums, lying, hitting, being lack of motivation, feeling closed off or withdrawn, depression, fighting, self-injurious behavior, self-harm, absolutely, screen addiction, running away. Great answer. So I appreciate that. And it's really on a spectrum that you guys answered, from some more serious, severe, maybe less frequent, but more intense behaviors, like those maybe aggressive behaviors, and also to maybe some of those high frequency, like crying, whining, tantrums. So we're going to be talking all about that today. I do want to preface that the skills that we're going to be talking about might initially not seem like they fit with some of the serious behaviors that you guys mentioned. So I just want us to keep in mind that as we go through this together, these are skills that build onto one another and create a toolbox of skills to help to deal with some of those more serious behaviors. Okay, so let's start with talking about what does ideal parenting look like. So there's been, it's a loaded question. There's been decades of research on child development and attachment and the relationship between children and caregivers, right? And what the literature shows us is that if we kind of narrow it down very drastically, that children with a secure attachment to their caregivers are more likely to thrive developmentally. So thrive in their relationships and their self-esteem and understanding of their emotions and regulating their emotions. And when we look at caregivers of children with this secure attachment, there's this important balance there. This balance between nurturing interactions, so supportive, warm, loving, kind, right? With appropriate limits, right? Rules and boundaries. And there's this balance between these two. So after trauma, what can happen is this balance can be thrown off. We know that trauma has a significant impact on kids, but it also significantly affects the family at large and caregivers themselves. And so one thing we might see from a caregiver after a trauma is a high level of nurturing and maybe a low level of limits. So I just want to hear from you all. How do you think that might impact a kiddo when there's in the home a high level of nurturing, warm, support, love, kind of all that, but no limits, really low limits? How might that impact a kiddo? What behaviors might we see? Confusion, anxiety, manipulation. I'm gonna write that down and come back to that. Entitlement, poor decision making. Yeah. No boundaries, right? Lack of boundaries, strong will. Maybe some impulsive behaviors. Absolutely. So that really hit the head on the nail here. When there's a very low limits, but high nurturing, we tend to see kids who have more difficulty regulating their emotions. They might be more rebellious. They might be more defiant. As you said, there might be low persistence, so lack of motivation. Absolutely. So great answers. Okay, another question. You guys are doing such a great job engaging in the chat. I'm just going to keep on going. What are some thoughts that caregivers might have that might kind of maintain this type of parenting style, right? Because most caregivers want to do the best for their kiddos. And so what might caregivers be thinking that might maintain this kind of balance in the house? So I see some guilt there. I don't want to push them too hard. Absolutely, they just went through a really difficult thing. I don't want to push them. Maybe they think this is what they need. They just need all of this. They might feel guilt or regret. Maybe I exposed them to that trauma. Absolutely. So you guys are right on the money here. So for birth caregivers, they might feel some sort of guilt because maybe they have the thought that they let their child get hurt. For resource caregivers, they might think, you know, this child needs all the unconditional love because this was never really shown to them, right? Or this child has gone through so much, they just need to be loved. That's all they need right now, right? And so I love where you guys are going and how you're kind of getting into the thoughts and feelings of what a caregiver might go through after a trauma, because it's really helpful for us as health professionals to start to see how caregivers' thoughts and feelings can change after their child's trauma and how we could start to put ourselves in their shoes so we can really genuinely connect with them in this way. Okay, great. These are great examples. Okay. So on the opposite side, this can also happen after a trauma. So we might see this imbalance in this direction. So low level of nurturing and high limits. Wondering, you know, for kiddos, this might affect them in terms of feeling low self-esteem, feeling anxious, and some of the thoughts that caregivers that might maintain this type of parenting can be, you know, this child will need extreme discipline because this was never modeled for them. So this is what I have to do, right? Or structure is the most important thing because this is what they were lacking, right? And so today what we're going to do is spend time learning about ways to keep this balance, skills around limits and consequences, but equally important will be skills around that nurturing and that relationship. And actually, I take that back. I would say not equally important, but I would say sometimes even more important is that caregiver-child relationship when we're talking about difficulty with behavior problems and behavior change. Okay. Okay, so now we're going to move into the importance of assessment in managing challenging behavior. So when behavior problems occur, like all the ones you shared earlier today, there's going to be a lot of high stress, frustration, confusion in the house, right? It's really hard to figure out what's happening and what direction to take and how we can help the families that are coming to us. So we're going to take a look at behavioral difficulties in kids with trauma, kind of general behavior problems, and a way to work with caregivers to assess what's going on. So this might be a familiar slide to folks. We're all probably a bit familiar maybe with the fight, flight, freeze response. It's the body's alarm system, and it happens after a trauma. And after a trauma, that alarm system in that kiddo is kind of broken, right? The alarm keeps going off, even though there's no danger around. Maybe it's a familiar smell or a specific date. Maybe it's a type of interaction or increased stress, but this fight, flight, freeze response is triggered. Sometimes it's easy to spot, and honestly, sometimes it's really challenging. It can be invisible. But when kids are in the fight, flight, freeze response, they're truly in survival mode. Their brain is in survival mode, right? So the thinking part of their brain is flipped up, and they're really guided by that feeling part of their brain. So we can imagine for kiddos that this isn't the most effective mode to start thinking through or solving problems, and it makes it that much more challenging to regulate their emotions. So what does it look like? How can we tell if a kiddo is in fight, flight, freeze? What are some clues? So the first is that the behavior that you see or the behavior that the caregiver is explaining to you, it's really extreme emotion. The behavior feels like it's out of the blue. You're like, what is going on? It's a really big response to maybe a really minor issue. Happens very quickly. It feels like it's 0 to 60. The child is really unable to calm themselves down, not responsive to that reasoning. The distress may last a long time. And then after, the kiddo really kind of appears to be out of their body. After, what can happen for kids who have experienced trauma is they might feel some shame or guilt or embarrassment after and be a bit apologetic. I will have a caveat here. It's really hard to know for sure that a child is having a trauma reaction. It's just difficult, but we do have the clues and we have some tools we can use. Okay, so what I'm gonna do now, we're gonna watch a video and it's gonna be of a young girl. It's gonna be a little loud and it might be a little difficult to watch, but I really like this example and I really want us to be able to talk about it together. In the video, the caregiver is videotaping the child. And I just want to really, for us to try to ignore that piece. I'm not sure why that's happening. It's not something I'm condoning in this example. So if we could just put that piece aside, and what I'd like us to do is focus on the child and her behaviors. And then as a group, we'll kind of talk about it after what you've noticed. Okay, give that a try.
Okay, well, why are you crying though? Huh? What? You're not gonna look at me? Why are you so angry? Why are you so mad? Huh? Are you mad because you don't want to do your homework? You want to do your schoolwork? Well, you were homesick today. You have to do your schoolwork, honey.
Okay, so Cynthia, I really appreciate that comment. It never gets easier. This can, it's always, it can get to us. And I think that that's, you know, as helping professionals, not to kind of numb ourselves to the impact of this is important, and to recognize the impact that it does have on us is important. So I appreciate that comment. And so I want us to think about what we saw with the kiddo's behavior. Thinking that this child is experienced a trauma in her past, what are some of the behaviors that you noticed she was displaying? So not the parent, but the child. So she was hiding. She felt overwhelmed. She was hiding her face. She was shutting down. She was reactive. She was really angry. She was shouting, right? She was very defensive. She ended up lashing out physically, right? She wanted to be alone. She wanted to be alone. It was very obvious, right? That she said stop at one point and wanted space, leave her alone. Absolutely. So what we saw in that video is the child screaming out for needing that space, that she was not ready for any sort of stimulus, any input from a caregiver. That was a moment that she was clearly out of control and overwhelmed. Maybe there was a sensory overload, and she needed her space. And that is the way she asked for it. And so when the caregiver kept coming to her and kept approaching her, you saw at the end that moved towards maybe a slight act of physical aggression. Absolutely. Great answers. So what I want to highlight is that kiddo was in, it looked like a trauma response, right? Like, just like we talked about, feeling out of control. Clearly the emotions were at 100, really just not being able to take in any stimulus. There's no reasoning happening. It could feel like maybe she was triggered in that moment, right? And so we don't respond to that type of behavior the same way we would respond to a kiddo that hadn't been through a trauma, or if it was just general misbehavior. So I want to go over some important kind of skills to that kind of trauma reaction that we can work with caregivers around. So one is creating a sense of safety. So when that child is having that trauma triggered reaction, right, they're maybe in that fight, flight, freeze, their thinking brain is flipped up and they're really regulating and operating from that emotional part. That's a time as a caregiver, as a helper, to create that sense of safety. Stand a few feet away and speak in a calm and quiet voice. Briefly reflect emotion if we feel like that's appropriate. So tell the child that you can see that he, she, they is feeling upset and that you're here if they need help. Maybe offering to do or model a coping skill might be helpful. So as you stand back, you know, doing belly breaths, having your hand on your chest and your stomach, and mirroring, using a coping skill, not necessarily asking them to do it, but just mirroring it yourself, mirroring that sense of calm. And then giving that child the time they need to calm down, right? Backing away, less language. The language and the stimulus is overwhelming in that trauma reaction. We also want to instruct caregivers to stay a bit close by so that child can then come to you when he, she, or they is ready. So I will say that this is not easy. My emotions immediately went up as the kiddos did, and that's what will happen with caregivers. And so caregivers might need some assistance from us in helping them to do this. Talking with caregivers and normalizing that this is hard. A lot of the skills we'll talk about today are not rocket science and they seem kind of easy, but they're hard to do. So maybe going through a role play with the caregiver if that feels comfortable, having the caregiver come up with their own positive coping thoughts during this moment, like this will be helpful for my child, this will be helpful for my child, to help them regulate themselves as well, and have that caregiver practice maybe their own deep breaths. Okay. So with a lot of the skills or tools we'll talk about today, I've got some handouts for you all that will help reinforce the material we're talking about, because I recognize this is a lot of information. But these are handouts that you can use with caregivers. So the Coaching on Coping Skills is a wonderful handout to use with caregivers. It really just goes over everything we just talked about, what behaviors after a trauma can look like. So it provides that caregiver some psychoeducation and ways that they can respond. So kind of just what we went over. It also reminds and reinforces the caregiver to take some time out for themselves as well. And then within any presentation I do on child trauma and behavior difficulties, I like to give a handout on effective treatments for youth. So this just goes over effective treatments for trauma in a really caregiver-friendly language. So the skills and tools we're talking about are going to be very useful. But if a child, just a caveat, if a child is experiencing post-traumatic stress symptoms, then they might need additional support and help. And so I wanted to provide a handout around effective treatments as well. Okay. Okay, so now we're going to be talking about just general misbehavior. Again, trying to differentiate the two, although I take it with a grain of salt, it is a very difficult thing to do. So we're talking about general behavior problems, not necessarily trauma reactions. They typically involve kind of active defiance or oppositionality, are maintained by rewards in the environment. So whenever Maria starts to yell, she gets the iPad. If I'm Maria, maybe I'm going to yell to try and get that iPad, right? Are often created and reinforced through inconsistency, leniency, or unpredictability, which is very hard to maintain. So for example, if I hit my brother and I only sometimes go to timeout, and sometimes I don't, maybe I'll roll the dice because my brother is really bothering me, right? They may occur with trauma symptoms, right? Some kids just really don't like rules and will break them, and having a trauma and having trauma symptoms doesn't make it any easier. And then a big clue here is that they'll respond most effectively to child behavior management techniques, which are some of the techniques we'll talk about today, by itself. Okay, so we're going to watch another video. This is from America's Funniest Home Videos, I think, so it's hopefully won't be a triggering video. And it's a very obvious example, but I want you guys to take a look at the child's behavior and tell me what you're noticing. Okay, great, he wants attention. Okay, excellent. So what is the function of this behavior? That kiddo wants attention. It's pretty obvious. Now, I get it. This is a blatantly obvious example of seeking attention. It's not always as obvious what's happening. But what we're starting to try and practice or talk about is thinking, what is the function of the behavior? Because that's really going to guide what our intervention or the resources that we provide caregivers are going to be, right? Great. Yeah, so I love this comment that that type of behavior maybe has been rewarded in the past, and so the kid knows that he's going to keep doing it, right? It's reinforced. Absolutely. Okay. Here we go. Whoops. Okay. This might look familiar to folks, but this is what we call the ABCs. So here what we want to answer is what's going on and what's happening. These are a strategy that we can use with caregivers to help assess and understand what's going on in the home so we can better be able to provide tools and resources for them. So again, these are the ABCs of behavior. Behavior is maintained by the antecedents. So that just means it's the fancy word for what comes before the behavior, or consequence, which is what comes after the behavior. So in a minute, I'm going to talk about the antecedents and the consequences, but first I want to just talk about the B, which stands for behavior. So what I often hear from caregivers is, my child's acting crazy, they're off the wall, they're just out of control. I've heard the term defiant, right? And as a helping professional, I'm not really exactly sure what that means. And so our first step is to really help caregivers define the behavior. So we get to a point where it's, Jan is hitting his sister. Okay, I know what to do about that. Lisa won't stay in her room after lights out. Great, okay, that helps me, right? And so during this first part, we want to work with caregivers to learn everything about the behavior. What does it look like? How long does it last? Kind of paint me a picture. So that's really our first step. Okay, so then we go to the A's when we're starting to talk with caregivers about antecedents. What happened before the behavior? What led up to it? Were there any triggers? What was the overall environment in your house like? Was there a lot of stress? Were there any changes to structure or routine? This really helps us get a full picture. So as an example, I was working with a family whose kiddo was pushing kids at the bus stop. And if I just stopped there and didn't assess for the antecedents, I would work with that kiddo and family on keeping hands to themselves. But I talked with the caregiver and I talked with the child about what might have been happening before the behavior started, right? The antecedents. And it turns out dad usually drives kiddo to school, but parents recently got a divorce. And so dad stopped driving kiddo to the bus stop and to school, and he had to start taking the bus. And there were a lot of feelings and emotions around that. And hence this behavioral acting out came about. And so instead of just dealing with the keeping hands to self, I was able to get at kind of the root of the problem, right? And so for kids with trauma, we can really important to ask about those antecedents and potential triggers. Again, some of them are invisible, but we have to try our best. So things like, were there any important dates? Were there any visits that happened? Really taking time to assess what happened before that behavior so we can get a better understanding and we can be better to help. Okay. Same thing, we also want to ask about the consequences. So what happened right after the behavior? What did you say? What did you do? What was the kiddo's reaction? Right, if every time Joey is sent home from school, he gets to go to work with mom, maybe that's very reinforcing, right? So there are things we can do to change the behavior just by changing what comes before it or what comes after it, right? And that's a really, really useful tool to use with caregivers. So I created this kind of quick cheat sheet, if you will, that you can use when working with caregivers kind of to assess the behavior problems. It goes over, so we always start at the B with the behaviors, questions to ask caregivers, and then really trying to find out those antecedents and consequences. And this is really truly the first step in behavior management. So here are some questions we just went over to ask caregivers, to ask kiddo for both the antecedents and the consequences. Okay, so that's the assessment piece. That's our first step. So we know what's going on and we help the caregiver understand what's going on, which can also be really validating and really normalizing and really helpful. So another first kind of step in behavior management is building relationships, not only between the child and the caregiver, but also between us and the caregiver. So we're not really going to get very far with caregivers if they don't truly feel like we understand the situation. And so many times I hear like, you cannot possibly understand. And so the next few slides are really about setting us up for success in helping our caregivers and our kiddos through caregiver engagement. Okay. So we're spent some time talking about collaborating with caregivers. The first thing we want to do is create space for caregivers to share their concerns, align with that caregiver, and think to ourselves, are we creating a message of hope? So we really need to hear those unpopular thoughts that caregivers have to allow for potential for change. So really kind of not interrupting and just letting it all out and knowing and letting them know this is a safe space to share all your feelings that you're having about your kiddos. In terms of aligning and communicating that message of hope, that empathy from us really does need to be genuine. And I think it's really important to be honest with ourselves as helping professionals, but sometimes this is just harder to do with some caregivers than others. For whatever reasons, that's definitely just a true thing that happens. And that's okay. That's normal for us as well as helping professionals. We've all had that caregiver that we're like, oh no, they're on my schedule, or God, I just don't know what to do with this family, or what's going on. Or I don't want to see that caregiver. And so really listening to those thoughts in your head and identifying them and taking a moment to reflect and pause and think, why aren't I aligning or feeling empathy for this caregiver? And how can I find just that sliver of empathy so that I can genuinely align? Because without that, I'm not sure that we can really make any progress, no matter if we know all of the evidence-based skills and tools to help with behavior change. So what I'll do sometimes is when I notice myself having those kinds of thoughts, I'll check in with a colleague and be like, okay, this is what I'm thinking. I think I need to move a little bit towards the middle here. Buy-in for behavior management is also super, super important. These are things that we're asking caregivers to do in their homes. And so if they're not bought in, it's not happening. So the first thing that we want to do is check with a caregiver and check their assumptions and provide accurate information. So caregivers need accurate trauma-informed understanding of a child's behavior to help engage in any recommendations we give. So I'll give you an example of what that might look like. So here are some common misunderstandings of child behavior. These are things that I hear very often that kind of get in the way of a caregiver wanting to do or try any of the resources or activities at home. So first, maybe that caregiver has a developmentally inappropriate expectations for that kiddo. So sorry, I just noticed the thing that this aligns with Triple P. All of the things that I'm pulling from are from all of those great evidence-based parenting, parent management training. So Incredible Years, Triple P, Kasman's model, Barkley's model, they've all got a real kind of core elements. And so I appreciate you identifying that, and that's what we'll be going through today. So thinking that my kiddo is a pathological liar, my 7-year-old is a pathological liar, when in reality, we know that lying can be kind of normal for kids. They're testing it out, they're trying it out, and it doesn't make them a pathological liar. Or my kid isn't upset unless they're caught, so they have no remorse and they're going to grow up to be antisocial. So let's provide some education around these topics in child development to help the caregiver understand and have developmentally appropriate expectations. We also often see over-personalization of the misbehavior. So they're doing it to get at me, or this child is disrespecting me. So maybe we provide information about children with trauma and the challenges they have in regulating their behavior. It might be about them sometimes, but for the most part, kids are engaging in these behaviors to either get attention or avoid something that they don't like. And then I can never say this word, pathologizing the child's behavior. So I hear a lot the term manipulative, and that's a weighted term, and it has a very negative connotation to it. A lot of times an 8-year-old is not really going to be manipulative. They're just trying to get their way, especially after a traumatic event when the sense of safety and control has really been taken from them. And so we want to, again, put our trauma hat on and help that caregiver understand. I can definitely see why you're thinking that. I hear this a lot from caregivers. I wonder if I can provide you some information about trauma reactions and trauma behavior and some common behaviors kids might have and what we can do about those. Okay. So I'm going to talk a little bit about now checking assumptions of caregivers. You might notice this triangle. It's the thoughts, feeling, behavior triangle or the cognitive triangle. I promise you, I'm not going to ask you guys to do cognitive behavior therapy with a caregiver, but I do think it's helpful for us to be listening when we're talking with caregivers for those unhelpful thoughts that might be getting in the way of having any success with the strategies that we want to use. So we're going to do a little activity together. If a caregiver is thinking, they're coming to you, there's so much difficulties in my house, my child has gone through a trauma and they're broken and they'll never be the same again, right? Just as an example. If you can put in the chat, what might this caregiver be feeling when they're having these types of thoughts? Hopeless, hopeless, hopeless. Helpless, hopeless, absolutely. Maybe scared, maybe in distress, absolutely. Overwhelmed. we're probably not at our best to implement behavior strategies when we're feeling shame, powerless, overwhelmed, hopeless, and helpless, right? So maybe they're just going to be lenient, maybe they're going to be checked out, and maybe a bit disengaged. Again, helping to understand where that caregiver is coming from and what their thoughts are, that really helps us align and join with those caregivers. So this is where we want to focus. We want to focus on those thoughts, and what we want to do is simply just validate. I know a lot of families, I know a lot of parents have the same thought. Would it be okay if I provide some information about child trauma and resiliency? Is it okay if we talk about that? Right? And you're going to save yourself so much time than jumping straight to, hey, here's how to do timeout. Because if the caregiver is thinking, my kid's broken, they'll never be the same, nothing will ever change, and you give them a tool, the likelihood of them following through with that is going to be very low. So this is a really important thing to engage caregivers with before we start to introduce some resources. So instead, where we want to get to caregivers is what happened was terrible, but my child is strong and we can get through this with support, right? They feel empowered, they feel hopeful, and maybe they'll try and use some of the skills to address some of the behavioral difficulties. Okay. So here are just some language, some examples we can use. You might all already do this already, so that's great. If you don't, here are just some examples. Asking caregivers permission. Would it be all right if I told you some things that have worked for other parents? Clarifying information needs and gaps, right? What do you know about coping skills? Maybe they've already tried that, and they probably have. They probably told you, like, tried it a million times. So learning that information is very helpful. Is there any information that would be more helpful right now? What skills did you learn, or what skills have you tried in the past? It's a very helpful conversation to have. Just some clarifying language to use to help, again, join and align with caregivers. Does that make any sense? What else would you like to know? How does that apply to you? So what do you make of that? What do you think would be a good next step for you now? Okay, so there's a handout, not surprisingly here. It really summarizes what we've done. And I think it's I love this handout. I think it's a great handout to give to a caregiver. You can go through it together with them, or it's something that they can go through on their own. It's called Working More Effectively with Caregivers. Sorry, this is not to go over with it. This is just for us as helping professionals. So it gives ourselves some self-reflection. What am I feeling? What's coming up for me? What is a more helpful message to myself maybe about this caregiver? What are some engagement strategies? So am I providing praise? Have I asked like what their biggest problem is? So it's just kind of like a trigger for us to make sure we're using all these good skills. And then it has some skills for teaching strategies and check-in. So have I asked if they're willing to try and practice an activity this week? Did I set a goal for this week? Did I practice in a role play with my caregiver, with the caregiver? So it's just kind of helpful tips and tricks for us. Okay. So I want to share this cycle with you. It seems like we've got a really astute group here, so this might be familiar. It's called the Patterson's Coercive Cycle. It's one of the most common behavior cycles that occur in families, and I find it really helpful to go over and to think about where we can intervene as helping professionals in the circle. So we're going to go through it now and then talk about strategies to put in place instead of escalation to help support changing behavior. Okay, so the first thing, I hope you guys can see this, is that a parent gives a command. So it's bedtime, turn off the TV. Child refuses and maybe starts to get bothered, right? No, please, just 10 more minutes, please. No, I told you we go through this every night. We're not putting on the TV, right? So parent becomes agitated and it escalates. Then the child escalates. It's not fair. I really want to watch TV. Caregiver then escalates. I'm not doing this again. You get the idea? Child escalates. And then finally, this is a long process and it's exhausting. And at the end, caregiver either gives up, in which case the tantrum that just happened, the escalation, is reinforced. So kiddo learns, oh, I just have to go all the way to the purple zone. And then I get to watch my extra 10 minutes of TV. And they're also, bedtime has now been pushed back because this process takes a lot of time. Or the parent succeeds and they turn off the TV. But however, this escalation cycle is reinforced now. So there's really no win-win here. And so what we're going to talk about together are where and strategies of where we can intervene within this cycle. Before we get into it though, I think I'm going to pause here. I recognize we're together for 2 hours and there's a lot of information coming at you. So before we get into some of those behavioral strategies, I'm going to give everyone just a 5-minute break to go to the bathroom, turn off your camera, just take in the information. Maybe there's some questions that you have, and then we'll come back together at 10:55 and we'll start to talk about strategies and resources we can give to caregivers. Okay, and we're back. All right, so we're going to move on to the next slide. Okay, so this is where we're going to start. We're going to start talking about shaping behavior through positive relationships and reinforcement. And I just want to share what we mean by shaping behavior. So oftentimes when I'm working with caregivers and kiddos, they want to get the kiddos, let's say, hitting sister or let's say 10 times a day. This is an extreme example. And they want it to stop completely, right? Which is great. But when we're talking about shaping, that's going to be really hard to do, to go from 100 to 0 or from 10 to 0. So when we're talking about shaping, we're talking about making incremental change and rewarding it along the way, which is a much more successful strategy to change behavior. And we'll see some examples of that as we go. Okay, so we're going to start focusing on positive relationships, not surprisingly, as you've been hearing me say, and positive reinforcement. So this is kind of a way to stop the cycle before it really even begins. Kids are much more likely to listen to caregivers if there's a strong positive relationship. In fact, it's one of the most strongest findings in the literature that discipline strategies are much less effective if we don't first work on that relationship piece. That's kind of common sense, right? You're more likely to listen to somebody when you've got that good relationship. You know, after a trauma, we know that there's such high stress and that behavioral difficulties are normal, and that it's normal for that to impact the parent-child relationship. And so these are strategies that caregivers can implement to help build and strengthen their relationships. This is also a skill that you can do with the kiddo that is maybe coming into your office or your Zoom space. But I also urge, this is something that caregivers can do with their entire family. So sometimes there's one kiddo at home, but a lot of times there's more than one, and it can be hard to use these strategies with just one kiddo, and then another issue starts over here. And so I also welcome that these are strategies that you can use with the whole family. Okay, so this is just an analogy with caregivers. You really can't take things out of the bank if the bank is empty. And when caregivers come to us with really serious behavior problems like hitting or maybe running away, it might feel really strange to offer these positive reinforcement strategies. It feels like maybe it doesn't fit the behavior, and maybe the parent might be like, no, you're not hearing me. This is a serious behavior. So it's really helpful for them to understand the rationale, maybe the research and how it's proven. And it really is important to help with buy-in. Okay, so one of the strategies is labeled praise. Again, this might be very familiar to folks. It might be very new. So labeled praise increases the behavior it describes. It increases a child's self-esteem, and it's more effective than just regular old praise, which is good job. Again, not every kiddo needs this, but some kiddos do. So instead of saying good job, way to go, which is what we often say, we say, you did such a good job listening when I asked you to clean the table. Awesome job sharing with your brother, right? It's a really useful skill with younger kids, but it can still be important for older kids. We just have to find our own language that doesn't seem kind of babyish. So here are some examples, and these are helpful to give to caregivers who, anytime we change the way we talk, can be a challenge. It can feel very awkward. So having some prompts in the beginning might be helpful. So instead of you're doing a nice job playing gently with your toys, thank you for helping clean up. I like it when you use your indoor voice, right? So when we're working with caregivers, we're really trying to think, what is the behavior that you'd like to see? And how do you just praise it, praise it, praise it? Because you're giving attention to the behavior you want to see more, right? So if we're working with a family where the kiddo is really impulsive and just kind of grabs everything all the time, whenever that child waits patiently, it's a party. We just praise, 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 right? And what we're doing is we're shifting our attention. Instead of saying, stop grabbing, right? We're shifting to, great job being patient. I love how you waited patiently there. We kind of talk about it as catching them being good because it might be a challenge for some kids. You're not often going to see it. And so when you do, you're trying to like catch that good behavior so you can praise it right away. So giving this as an activity for caregivers to practice during the week and report back, how did that feel? What was it like? Did you notice any changes? Could be a good activity. I really like that this comment here that even for high school students, it can still be very powerful to hear I'm proud of you. Absolutely. As an adult, I mean, I don't think we ever get rid of feeling good about praise. And a lot of times when we're in that household where we talk about those scales being imbalanced after a trauma, and especially when there's a lot of behavior problems, what the kiddo is hearing and what you're saying is a lot of stop, no, don't. And so to balance that out with praise is going to be really, really important. Okay, so another tool that we can use with both kiddos and older kids is something we call special time. With teenagers, you might want to call it something else, or they can name it, or you don't have to name it at all. But essentially, it's just again, an activity to increase and strengthen that relationship before we're putting in any consequences or any other discipline strategies. So with school age kids, we're talking about, I mean, 5 to 7 days a week would be a goal, but as often as that parent can. Choosing several toys that the child likes, and the kiddo can choose the toys, so things like crayons, Legos, blocks, Play-Doh. Really avoiding toys that limit conversation, because the purpose of this is just spending 5 minutes where it's different than any other time you spend with your kiddo, because parents play a lot with kids, but this is a 5 minutes of time where the purpose is just to kind of praise and give positive attention to that kiddo, kind of like in a short dose, and really trying to avoid toys that also have rules. For teens, maybe 3 to 4 times a week, maybe 10 to 15 minutes. Again, the teen can choose an activity that's enjoyable to them, or the caregiver can just join in an activity that they do. You might be noticing that none of these strategies are extremely complex. They seem quite common sense. I will say, though, that they're really challenging for caregivers to do when there's a high stress in the home, and it's helpful to have some support. It's helpful to have some structure. So working with a caregiver and saying, okay, what days of the week would you like to do this? Let's write it down in your calendar. What time? Let's find a time of the day that's good for you. You know, and really kind of structuring it out, which really increases the opportunity for success. Okay, surprise, surprise, there's a handout here, a resource to give to caregivers, just some labeled praise examples. So it really describes everything we just talked about in terms of labeled praise, why it's effective, why it's helpful, and it offers those caregivers examples. I also want to highlight, Santiago, your comment that I do like the 5 minutes, because it's hard to find the time, right? It's not realistic to sit down for 30 minutes a day with your with maybe a caregiver that is multiple jobs, a single parent household. There's other kids running around, right? What do you do with other kids when you're having one-on-one time with this kiddo? So it can be challenging, and so allowing it to be short is very appropriate. And also being able to do it with all kids, because it's just an enjoyable activity, can also be something so that kids don't feel left out as well. Okay, so that's the first piece before we even start this cycle, really helping caregivers build that relationship. Now we're going to talk about shaping behavior through appropriate commands. So what I mean by this are, why won't he listen, she listen, they listen when I tell them to be good, right? That's what I hear a lot. And being good, that really means something different to everyone. And kids don't really know what we mean by that. Again, for some kiddos, it's enough. They know what that means, they're good. But for other kiddos, the kiddos that we're talking about today, it won't be. So how do we give effective commands? So we want our commands, which is what we're telling our kiddos to do, what caregivers are telling their kiddos to do, is to be direct and specific. So for some, clean your room is fine. For other kids, they might need a little bit more. So I would like you to make your bed and put your clothes in the hamper. Very direct, very specific, right? Clean your room can kind of open ourselves up for an argument, because what does that really mean? So we really want to operationalize what we're saying here. To give commands one at a time. Sometimes you hear, go upstairs, clean your room, brush your teeth, come back down, and then we'll read a book. It's like, For kids with ADHD, that can be really tough. Also for kids who've experienced a trauma that might be having some difficulty with attention, that can be a little bit challenging as well. So trying to give commands one at a time can be really useful in increasing that follow through. We want to positively state what we want our kiddos to do. So your room is filthy, clean it. Not the best approach. So how else can we say that? We want to use a polite and normal tone. So challenging to do. It's really hard to be consistent with that. It's not always going to be the case, but working with caregivers to take that deep breath, make sure they're in a good space before they give that command. And if you count the times that caregivers give commands to kiddos throughout a day, it's a lot. So when you're working on a specific behavior problem, we really want to kind of limit the amount of commands that we give, especially if kids are struggling to follow through. Really be mindful of the ones that we really want them to work on. So I have a question here. Can you give an example of kind of a positively stated command? So instead of just your room's filthy, clean it. It would just be like, Johnny, please clean your room, or Johnny, please put your clothes in the hamper. Okay, so this is just some, again, tips, some example language that you can give to caregivers. Again, when we're changing our communication style, it can be tough. So pick up your toys. What would be a better one would be pick up your toys and put them in the toy box. Be good, don't fool around. When you're on the school bus, remember to keep your hands to yourself. So again, this tool, again, on its own is not gonna miraculously change everything, but as we're building the toolbox, all of these tools really come together to make an impact. Carlos, go tell your brother to hurry up with his shoes. Instead, let's direct that command to the kiddo that we're trying to get the behavior changed. So Max, please put your shoes on in the next minute or so, and I can help with your code. How many times do I have to tell you? So starting out with that is probably going to start the escalation cycle. Sam, please turn off the TV. Is it a good idea to play so rough? So we don't need to make it a question. We just want to be direct. Roll the car more slowly on the ground. It will break. So again, this is something you can talk about with caregivers and kind of helpful language you can share with them. Okay, the last one in this kind of section are rules. So pretty popular. Rules are important for maintaining behavior, especially for kids who have experienced trauma, when that structure is really important and it can create a sense of safety. And so we want to ask caregivers about the rules in their home, right? They might not have any, and so this is where we come in. They might have 10, and that's too much. So we can't have a rule for everything, right? And so I typically tell caregivers really no more than 5 house rules. Otherwise, it gets just pretty complicated to follow through and make sure all those rules are being followed. It's also hard for kiddos, depending on their age, to really keep all that in their heads as well. So really limiting it to the ones that you need follow through on. And you might notice a theme here about being specific. So we really want that rule to be very clear. So if it's respect everyone, that might be enough for some kids, it might not be enough for others. So we might need to define that more. So really thinking about, can I see this behavior? Can I observe it? And is it well defined? Yasmin, I noticed that comment. Definitely there's definitely families have got like 15 rules in their house, which again, for some folks, it's perfectly appropriate and totally fine. But for other kids where they're having some real behavioral challenges and you're working on specific behaviors, it's really helpful to set that limit. Okay, so moving through our cycle, shaping behavior through active ignoring. Again, some of you might have heard this, some of you might not. I love this tool. It's so helpful. It really can be like the ace in your pocket. It can really help kind of crush the cycle in its beginning. So this skill is really all about ignoring the behavior you don't want to see and paying attention to the behavior that we do. Okay. I'll first start off by saying, don't be fooled by the name. Ignoring is an active process. It's not passive. It can also be very challenging for caregivers to do. Okay, so what are we talking about here? no reaction to the behavior. And it's a non-harmful behavior. Obviously, if the child is hurting themselves, hurting others, or seriously destroying property, active ignoring would not be appropriate for those types of behaviors. But when they're like, that's not fair, angry verbalizations, you're the worst, I hate you, nasty faces, rolling eyes, smirking, mocking, mimicking, all those behaviors that really make the caregiver want to escalate, these are things that we can ignore, because what's happening is they're getting their attention. Ignoring means 100% ignoring, and I'll go over what that looks like in a second. Too bad if we were together, you would see me act this out. Unfortunately, I just have to use Zoom, but there's no consoling with active ignoring when you're ignoring. There's no last minute warnings, there's no nonverbals, you're truly ignoring, and you're remaining calm, and you're remaining dispassionate. So what I do want to mention is that sometimes parents are concerned after a trauma that ignoring might be, let's say, emotionally scarring or damaging to their kiddo. Again, especially after a trauma. And it's important to remember and important to share with caregivers that you aren't ignoring the child, you're ignoring the negative behavior, which is different. Okay. So what does this look like? So walking away and busying oneself with an activity, what's going to happen, I guarantee, is that the behavior will skyrocket. So if every time Johnny makes faces at the table and interrupts, and he gets all the attention for it, and now all of a sudden everyone's ignoring it, or mom's ignoring it, or dad's ignoring it, what's going on? Why isn't this working? Let me push a little harder. And so it's going to increase. And so preparing caregivers for that is essential, because otherwise it's just going to devolve. So letting them know that we're going to try this new skill. However, the behavior is going to increase at the start, but then it's going to go down, and we'll see it be extinguished in the end, which is really, really helpful in what they want. And so it's kind of walking away, maybe moving to another room, just physically ignoring, not looking. You might have to move if the child's, trying to get your attention physically, really helping them practice what this looks like. So one thing that I find helpful is introducing, when we're introducing the skill to caregivers, and we can instruct them to tell the kids ahead of time that they'll be ignoring the kiddo if this behavior continues. Because some caregivers are a bit uncomfortable doing this. It doesn't feel right for them. And so giving that little warning can be helpful. So I'll give you an example. Let's say kiddo Lena is taunting her mom at the dinner table, trying to get her attention, interrupting the family conversation, making rude faces. Mom can let her know that she will be ignoring her if she keeps doing this behavior. She can get up from the table, maybe walk away in an active, like, I'm not listening pose. Lena's going to escalate up the ante because this always works. So she's just going to try harder. But eventually, with no reinforcement, that behavior gets boring. It's not fun anymore. And it's just going to stop. The first couple times, it's going to be very, very challenging. But the more that you can be consistent with this activity, it really is a great tool to extinguish that behavior. So I'm just going to notice some of the comments here. I'm assuming this would not be the case for violent behavior. Absolutely. So we do not use ignoring for violent behavior. We do not use active ignoring for like destruction of property that's serious. Obviously not for running away. So anything violent, anything that can harm the kiddo or harm others, this is not an activity we use it for. It's really for those kind of high frequency annoying behaviors. Okay. Okay, so we're going to move into consequences and behavioral rewards. Oftentimes, this is where parents want to go immediately. My kid's having difficulties. Teach me timeout. I want to, how do I use consequences? What are some privileges I can remove? This is kind of where caregivers probably think we're going to go is helping professionals immediately. So again, I'm just reinforcing that all the stuff that we went through earlier about building that relationship, about aligning with the caregiver, about increasing the parent-child relationship, those are all really, really, really important tools to use before we get here. And there's actually some evidence, some research that has kind of in parent management trainings have switched the order of first doing this and then using some of the labeled praise and special time. And we see a greater reduction in behavior problems when we start with those positive tools first. So if I haven't hammered that point home enough, there's another example. Okay, so these are going to be behaviors like hitting, curses, behaviors that are just not, the caregiver is just not allowing to happen. Okay. So consequences and behavioral rewards. So obviously a popular one. And so here are some tips that we can give to caregivers when they're going to be removing privileges. So first, it should be done immediately, or at least in the short term. It really won't work if you're taking away something the next day. Oh, remember you didn't treat your brother nicely, you hit your brother, or you yelled at grandma, we're not going to be able to go to the park today. It's for kids, that's a long time. And so the more immediate the consequence can happen, the better. And that's not always going to be able to be done, but the sooner the better. So avoid banning pro-social activities. This is a big one. So I often hear from caregivers, well, they're acting out, they're getting in trouble in school, they're being rude to the teacher, they're not going to be able to go to soccer, they're not going to be able to go to any of their pro-social activities, the groups that they're in, which is often a go-to because kids love those things. So I totally get why that makes sense. But pro-social activities, if a kiddo is having behavioral difficulties and all the emotions that come with that as well, taking away pro-social activities that help kids learn social skills and keep positive behavior might not be so helpful. So we really want to kind of brainstorm if there are other activities or other things that we might be able to remove, and we'll talk a little bit about that might be rewarding for that child, but might not, limit them from socializing with other kids. For some kids, it might be okay and they'll be fine, but for other kids that are really struggling with social skills, taking away their one kind of pro-social activity might not be the best idea. Okay, we want to combat removing everything. I often hear there's nothing left in their room but the bed, right? I've taken everything away. There's nothing left to take. And so we need something left for kiddos to lose, right? They might hit their brother later that day. But really, we want to make sure that there's a way that they can earn back the things that we've taken for a couple reasons. One, if they lose everything, this removing privileges no longer means anything to them. What does it matter? I've lost everything anyway. Also, it's really, we want to keep what we've earned back. So if they've taken away video games and they've managed to earn it back, maybe by doing some chores, maybe by some other ideas that caregivers come up with, it makes it even harder. They don't want to lose that video game even more. So putting in strategies to earn rewards back that have been removed, or privileges back that have been removed, is very helpful. And then we want to keep the length of the removal reasonable. So no watching TV for a month. That's a pretty significant removal of a privilege. I'm sure that is really impactful for that kiddo, but as a caregiver, can we really follow through with that? Probably not. And then if we give in, then what is that message does that send? So when we're working with caregivers, I'm thinking about removing privileges as a consequence for negative behaviors. These are just some helpful things to think through with them. Okay, so we're going to move on to behavioral rewards. And I think we've only got 2 more skills left. I know there's a lot of information here. This is a pretty popular, unpopular strategy because it can be pretty hard to make it effective. So we're going to go through some kind of tips and tricks to make these behavioral reward systems really work for the families that you are trying to help. So I'm sure that a lot of the caregivers that you work with will have at some point tried some form of a behavioral reward system. They're very effective, but they're very tricky to keep up. And so simply put, a behavioral reward system is creating a behavioral goal, creating a behavior schedule. So when in a day does this problem behavior occur? And then creating a reward menu. So rather than keep talking about it, I'm going to go through an example of what these look like. Before I do that, I'd love to get a sense of folks on the call. Have you done and worked with caregivers on creating a behavioral reward system before? You could just blitz the chat with yeses or nos. You see some yeses, some nos, a lot of yeses. Not like this. Yep, so this might be a bit different. Some nos. Okay, so great. Some emphatic yeses. Great. So I'd love to hear for folks who have done this as we go through. Feel free to share in the chat like questions you have or things that have gone wrong or challenges or like roadblocks that come up with this because it's a really, really useful tool, but it can be a bit of a challenge. So we'll just go through it together, but I'd love to hear even what's worked for you all. If you've done this, that would be great, or some challenges that you had. Okay, so here's just an example of what a behavioral reward system can look like. So I'll kind of walk through us together. So on the left-hand column, what you see are the behaviors. And again, here we want them to be specific, observable behavior. So that's really big. We need to be able to observe what's happening. So be nice. I don't know what that really means. I'm not sure I can really observe it. So we want to be very specific. And so we work with caregivers on coming up with the different kind of behaviors to add to the chart. Hot tip, I usually throw in one that the kiddo is not struggling with at all because they need to earn this the first time we introduce it in order for it to mean anything. If all of the behaviors the child is really struggling with and they don't earn anything, they're not gonna care about this thing, right? So we really need them to earn the rewards. And so let's say in this example, this kiddo makes their bed every day, or most days, or I don't think it's gonna be that hard after talking with the caregiver. So I'll throw it in so we get some stickers on here, right? Whereas getting dressed in the morning and keeping hands to self is really what we're focusing on. So that can be helpful. Okay, so then we figure out how many days a week. Usually it's going to be the school days. I rarely come up with behavior plans for kids on the weekends, although it depends on the family and really talking through about when the behavior is occurring. So it's really unique for them. And the behavior is going to be simple. Is it a yes or a no, right? We want to keep this simple and easy. The simpler, the better. Because again, caregivers are going to be the ones having to observe this and follow through on this. So makes bed before school, gets dressed before 8 a.m., keeps hands to self, yes, no, and you're checking for that behavior Monday through Friday. We then want to come up with rewards. This is where a lot of the plans kind of fall apart. We want to work with the kiddos to come up with the rewards themselves. Now, some of them we were going to dismiss, right? Like some of the rewards are hilarious, like, I don't know, going to the moon and things that obviously are not going to happen. But we do want to come up with, we want the child to be involved in coming up with the rewards. I'm also a really, really big fan of a reward menu. So rather than just having one reward, let's come up with multiple rewards, as you see here. So picking out a movie, again, that might be free. Choosing a game, staying up 10 minutes late, that's a real easy one. Having a friend come over, that's a big one. Having a Sunday night, one of the nights, maybe during the weekday, right? And so each of those are different amount of stickers, and this really gives the kiddo an opportunity for success. We really want to set this family up for success so that this kid can't wait to earn their stickers or their points, and they're excited about using the behavior chart. I do see a question, so I really appreciate that. Is it beneficial to start with a few behaviors rather than a lot of behaviors? Great question, absolutely. We really want to only start with a couple of behaviors. We don't want to start with everything. I would say I've rarely made a chart with more than 4 behaviors, sometimes 5 tops. but the smaller the better. We sometimes need more than 2, so we could get up to a variety of rewards, so we have enough yes, no's. That's the hardest part for me, is the math part, figuring out the sticker point content. But around 3, 4, 5 is probably most appropriate. I love this idea, Mary, of having a treasure box they get to choose something out of, so that's really helpful. So we as helping professionals might use these behavior charts in our own work with our kids and families, and we might have families use it at home. And if you're teachers or no teachers, this is probably very familiar. Teachers use the same sort of system in school as well. Speaking of school, sometimes, I don't have this example here, but sometimes the behaviors are happening in school and not at home. So caregivers coming to you being like, everything's good at home, but there's a lot of difficult behaviors that we're struggling with at school. And so coming up with a behavior plan for that child and asking that caregiver share it with the teacher might be very helpful. Some teachers have been absolutely wonderful in just checking on one behavior at school, circling the yes or no for the end of the day, and giving that behavior plan back to the caregiver. And so that could be a helpful way to try and target some of those school behaviors. So I see a question here. Is it advisable to add therapy or group? Oh, what a good question. As part of this chart, in the event that you have a kiddo who wants to, I don't know what that word means, on their mental health. Sometimes it's okay to check out, right? Okay. Yes, so I would, it's an interesting question, and I think I understand your question. I just want to make sure that using therapy as a behavior goal and to reward that. You know, I don't know if I have a perfect yes or no answer for that. I think it depends on the particular family. I could see why we might not want to use the reward system, maybe especially with older kids. If it's a group therapy, I would definitely probably say no, and you want that child to be able to have the agency to not participate if they don't feel like participating. But you can make it so they attend, perhaps, or if there's difficult behaviors before attending therapy, before attending group, you can target those behaviors as well. Great. Okay. Just making sure I didn't miss any other questions here. Great. I love the ideas that are coming in here, so I definitely would tell you to keep sharing those so we can learn from one another as well. Yeah, so what about distance learning? Using behavioral goals around distance learning. Yeah, being that school is in the house, I think that's perfectly appropriate. Coming up with goals that you want the kiddo to work on. So maybe you're working on keeping that camera on. And again, that's a good example to shape behavior. So I'll give you an example of that in the next slide. So maybe keeping the camera on, you can come up with other ideas that you're working on with that kiddo for the behaviors, or answering, or raising the hand function twice. So again, we're trying to move kids a little bit. We're not trying to push them all the way to having their camera on the entire time and raising their hands left and right. So here's a behavior chart, which is an example of giving them kind of some wiggle room. So here you see the behaviors are respects other people's things with 3 or fewer reminders. So for kids that are not respecting people's things 50 times a day, just putting on respects people's things on a piece of paper, it's not going to work. They're not just going to immediately go to 0. We're going to need to allow them to kind of shape down that behavior over time. So I really like this because it gives them some wiggle room here. Takes medication as instructed with 1 or fewer reminders. So again, there's some wiggle room here. So you can remind them and then say, okay, 1 chance left, right? Keep hands and feet to self with 3 or fewer reminders, or stays in bed after bedtime with 1 or fewer reminders. So it's, again, giving them some wiggle room. This one is an example for younger kiddos. So you see just the smiley faces can be helpful. And it's throughout the week. I really like this one. You can earn a daily reward. So for kids that maybe have a little bit more impulsivity or really need that immediate reinforcement, you can have a reward at the end of the day. And then you can have a weekly reward. And I really like that because oftentimes if a kid loses it on Monday, they're like, screw this plan. I'm not earning anything. It doesn't mean anything to me. But if you have a weekly kind of carrot at the end of the week, then that can be really helpful. Okay, we didn't make it today, but we've still got Tuesday, Wednesday, Thursday, Friday. I know you can earn this prize. So that daily reward and that weekly reward can be really useful. Kenya, that kind of helps answer that question. They can earn it that day. I would kind of recommend that to happen. That immediate reinforcement we know is much more impactful than that delayed reinforcement. So you can do it daily and weekly. Okay. So examples of rewards. They can be monetary, and that's perfectly fine. They can be, things that the caregiver buys for that child. Some caregivers don't feel comfortable using monetary rewards. And so I just, over time, these are some examples of rewards that don't cost anything that caregivers can use. So having time alone, having time with friends, whatever that child enjoys. Having friends overnight, it's a big one, right? Staying overnight with a friend. This was clearly pre-COVID. A night off of chores, that's a great one. Having some time with parent, I love that one. Extra time on the internet, or extra time on their screen, or extra time on their video game, or renting a video, or maybe staying up 10 minutes late, right? So there's a lot of things we can use that don't require any money, which is really helpful for caregivers. Okay, so don't worry, there's a handout that summarizes all of this information. There's 2 handouts here. There's a ton of resources on behavioral charts on the internet. It's actually a bit overwhelming. So these are handouts that you can use with caregivers. It walks them through how to set up a behavior plan, and then it has some easy templates you can use and give to caregivers if they don't want to create one themselves. I love that. Teens say that their biggest reward is having time alone or nagging them, right? Being able to be in your room with your door closed. Maybe that's a reward, right? We want them to be able to come up with those. Great. Okay. So for time with parents, I feel like for traumatized children, that shouldn't be taken away. And that's a good point. We don't want to, we'll talk a little bit about right now timeout, which we'll get into the attention away from caregivers and from just activities in children with trauma and some of the concerns around that. So it's a great lead in here. Okay, so I promise this is our last strategy that we'll go over, and then we'll have some more time for questions. I know I threw a lot at you guys today. Our last one is going to be timeout. So timeout, there's probably lots of different feelings that arise on this webinar when I mention the words timeout. It's a widely used discipline strategy for children, and we're talking about kids around 2 to 8, up to 10. This is where a lot of the literature is around school-age children. Although we can use timeout with older kids as well, we just modify it. We might call it something a little bit differently, but some of the core components are the same. But there is that confusion around and kind of concern around whether it should be used for children with trauma histories. So timeout is part of a number of evidence-based interventions for children with behavior problems. And these interventions have been found to be effective for kids with trauma. There is no evidence that there's any harm around timeout for children with trauma. And there's evidence that shows that there's a reduction in trauma symptoms when those kiddos are in parenting interventions that use timeout. So that's what the literature will tell us. There's some really good research out there around parent-child interaction therapy, which incorporates timeout, and some other behavioral interventions that use timeout that show not only a reduction in challenging child behaviors, but also a reduction in trauma symptoms, which is very promising. But there are some considerations that we might want to take, we might want to think about when we're thinking about timeout with children who have experienced the trauma. So it's especially important for work to be done prior to timeout and that caregiver-child relationship. It's not really a surprising one there, right? Engaging children in choosing a timeout space, one that feels safe and okay to them, is also really helpful. and going over the timeout procedure so it's not a surprise, that they understand what it looks like, right? Especially for kids with trauma, will be very helpful so they know what to expect. And I would argue that all of those are probably just best practice for kids with trauma, but also just best practice for implementing timeout. Okay, so let's talk about what this looks like. So I'm going to go through this a bit quickly. I could probably spend a whole 2 hours on timeout and practicing and talking about it. So for this, the purpose of this webinar, I'll go over how to set up timeout, how to do timeout, and then how to end timeout. So when we're talking about setting up timeout, we want to find a boring, unstimulating place. Like I mentioned before, the kiddo can help when everything's calm, when you're not really reacting to a challenging behavior. Find a place that feels okay for them. Determining how long the timeout will be really depends on the age of the kiddo. Typically, I say for young kids, 2 to 5 minutes to start. We'll talk about increasing and decreasing timeouts as well. Explain the procedure to the child. And so that's really helpful. So helping the caregiver to talk through, okay, how are you going to explain this to Max? How are we going to do it when we're calm, before a behavior occurs? We want to show the kiddo the timeout area if you're using a timer, and we want to explain the rules of timeout again so it isn't a surprise. Very, very important for caregivers is to make sure that they're calm and in control. So working with a caregiver to, again, practice their own coping skills, their own deep breathing. And then also really talking about the importance of follow through with timeout, which can be really difficult. So the first step is really giving that clear command. So instead of just saying, that's not okay, go to timeout. It can be confusing. What did I do? You really want to be clear. So Malik, you hit your sister, which is not keeping your hands to yourself. You now have a timeout. So before that, Malik will know, and the family will know, that keeping your hands to yourself is a rule, and that in the house, when you don't keep your hands to yourself, you go to timeout. Each family will create what behaviors are unacceptable for them, right? And again, I would have only a handful of behaviors in this category. We talk about using guided compliance if they won't go to timeout, only with younger kids. So just like a light physical guidance. These are 2 helpful things to help if the kiddo is not going to that timeout area. So one is a rule that timeout does not start unless you're in the timeout area. It's going to be stressful because this means timeout could last for a long time. Again, in the beginning, the timeout might last for a long time because the kid's running around the house, or if this is in school or wherever we are, and you just keep repeating, and we just stay calm. The timeout does not start unless you're in the timeout area. So I talk about calm and neutral. That's kind of the tone we're looking for. So hopefully that will help, but that will also increase the length of timeout. What that will also do is help the child to learn that as soon as they get to that chair, the timeout starts and then it can be over quickly. Another helpful tip here is to create a rule that they can earn time off if they go to the timeout chair immediately. So that's another rule you can have. So Sasha, if you go to the timeout chair immediately, you can earn, if timeout is 4 minutes, you can earn 2 minutes off your timeout. So your timeout's only 2 minutes. So that's also a helpful kind of tool or rule. And again, I would go over these rules before any behavior has occurred. Oftentimes, when working with caregivers and kids, I'll meet with a caregiver, talk through this, help them, share their fears, share what they're worried about, walk through that with them, and then bring the kiddo in and try and work with them together on having the caregiver go over what the rules are and explaining timeout. So I love that. They keep asking, is it over yet? Well, the things I've heard during a timeout, much worse than that. So yes, there will be a lot of noise for some kids during timeout. I hate you. You're the worst. Why are you doing this to me? Sometimes I hear this is abuse. Some really intense things. So what's really important to do when the child is timeout, and what timeout means is it's time out from positive reinforcement. So from attention, from reinforcement. So no attention at all. So if they're yelling, if they're in their chair, they can say what they want. Or in wherever they decide to take their time out, we're really actively ignoring that behavior. A timer is very, very, very helpful, especially for young kids, because timeout can feel like 7 years. So using a timer to show them visually how much time they have left is really helpful. One tool I would say is keep that out of the reach of the child because you don't want that kiddo grabbing it and throwing it across the room. Okay. So to that point, do not say anything until the timeout is over. Do not respond to anything that kiddo is doing. We don't want to provide anything reinforcing. I hear I have to go to the bathroom. That's a tough one. But if it's 5 minutes, it could probably wait. If a child leaves the timeout chair, so this is a common thing. We don't want to say anything. If it's a young kid, we can physically guide them back and stay calm. For older children, we can work through maybe having additional consequences as a rule before. So if you end up leaving your room, we don't have to call it timeout, we can call it something else. There's going to be an additional chore to do, or whatever the consequence will be. So what if the child keeps leaving the timeout area? Do they get more time for their timeout or just pause the timer when they leave? It's a good question. So we'll get into it. So they call it escalating and de-escalating timeout. So you can have, if the child leaves their chair, it's another minute on their timeout, right? So they can de-escalate their timeout. They can earn time off. If they go to the chair immediately, they can earn time off. If they sit quietly in timeout, they can earn time off. But if they leave the timeout area, they earn time onto their timeout. So that can be really helpful. It's difficult to do to keep everything straight. That's why caregivers need support around this. But it can be really helpful for those kiddos who are really trouble staying in timeout. And over time, it gets easier. It really does. But that escalating and de-escalating timeout is a great question because that can really be helpful. Okay. So to end timeout, probably take some deep breaths. Not the best time to lecture the kiddo about their behavior. Emotions are probably still high for everyone. And so this isn't the time to really have that talk around why it's important to be kind and respectful. It's just not the time. That conversation is important and maybe we can have that later, right? Because that emotions will still be high. So all we want to do after the timeout is over, and say your timeout's over, you've served your timeout, we're done. Like, great job. And then as soon as that child does something, anything good, like goes and sits down on the couch, goes and, walks to, it's anything good, we want to praise. We really, really want to give attention to that good behavior. And so we're shifting that energy. So the kiddo learns it's timeout, but as soon as that timeout's over, we get our positive attention back. Okay. Unfortunately, I don't have enough time to dive into this topic, and I'm sorry I lied. This is really the last thing, too much. And so I'll talk a little bit about a website here, but parenting problem solving is also very helpful for helping professionals to help engage with. So here what we're doing is we're helping the caregiver and that teen define the problem. So what is actually the problem? And a lot of times that's half the work. Right? So stating what the other person is doing or saying that bothers you in a way that got cut off. Sorry, that's positive. Listening. So each coming up with solutions to that. Some might not be appropriate, but we still want to come up with solutions. The caregiver comes up with a list of solutions. The kiddo comes up with a list of solutions, and we share them and we talk about it in a non-judgmental way. And then as a group, we pick the best solution. So I wanted to just highlight multisystemic therapy or MST for kids and teenagers with more of those serious behavioral difficulties. It's an evidence-based treatment. I think it's for youth 10 to 17. That's really wonderful. And it's for the whole family. So the website you see on the bottom here, it's a great resource. It's a great resource for caregivers. They go over what the treatment is, but even if a family is not interested in the treatment, there's resources there as well. They also have a map of providers, which I thought was very cool. So that could be a nice resource for finding a little bit more resources for caregivers around teenagers with some of those more serious behaviors. Another resource to give to caregivers is this great website that I just found. So Alan Kasdan is a leader in the field of parent management training. A lot of the stuff we've covered today is from his work. And so this is his website. And there's resources on here for caregivers, but there's also resources on here for professionals. So I think this is a really great website. And then I've got some recommended readings here. I think Your Defiant Child and Your Defiant Teen by Russell Barkley is wonderful. I know caregivers have found it to be so helpful. Also, it reinforces everything that we've just talked about. And there's activities for them to do, homework exercises, workbooks. So it's a really great resource. Parent-child interaction therapy is also a really good one. And then the Kasdan method, like I mentioned, his website earlier. A lot of them are quite similar in their core, just packaged a little bit differently. Okay, lastly, these are some resources. So Jess mentioned in the beginning that I'm the director of the ACTS grant, or the Advancing California's Trauma Informed Systems project. We have a website that is actually not the website. This is old, so I will put it in the chat at the end. It's just axproject.com. It's pretty easy. But we have resources for caregivers on there around child trauma, parenting after trauma, and about caregivers' own trauma. So that's not something we really touched on in this webinar, but oftentimes when caregivers are dealing with their child's trauma, they may have experienced their own trauma as well. And so when we're asking them to engage in de-escalating and dealing with challenging child behavior and regulate their own emotions, they could use also some support and some work around that as well. So there's some readings here. Okay, and so that's it. I know there's a lot that I presented on today, so thank you guys for sticking with me and asking great questions along the way and being so interactive. I just want to open it up if there are any other questions, and then I'll pass it over to Jess.
If there are any more questions, you can always put them right into the chat. But we do have a box that says Q&A along your menu bar. I'm just going to encourage you not to go anywhere because I have information about a raffle. So hold on one second. But in the meantime, Melissa, you might be able to see that there are maybe some questions